This is PharmaForum web editor Nicole Raleigh, and I am on site in Chicago for ASCO 2025. And with me today is Dr. Danny Nguyen, who is a medical oncologist and haematologist at the City of Hope, Orange County, one of the leading lung cancer experts there, and who has featured on several abstracts presented at ASCO this year. Pleasure to speak with you, Dan.
Thank you for having me here today, Nicole.
So there's been a wide range of data presented in the lung cancer space this year, I think it's fair to say. And I know this is going to be a huge question, but what are your thoughts on all of this that we've been hearing here at ASCO? Can you break it down into some sort of takeaway bite-sized chunks, if you will?
Well, I think that the key takeaway is that we continue to progress, trying to address unmet needs in various spaces. For instance, yesterday, Dr. Nguyen just presented the presentation on zipalertinib, which is an EGFR TKI that targets EGFR exon 20 insertion mutations. And in that presentation, she presented the data for patients who progress on chemotherapy, and then for patients who progress on chemotherapy and amivantamab, and who ended up getting zipalertinib. And she showed that those patients who had received prior chemotherapy and prior amivantamab, they had a 30% response rate with zipalertinib, and about approximately 60% stable disease with the treatment. So a disease control rate of approximately 90%. She also presented that patients who had baseline brain metastasis also achieved a response of approximately 30% with zipalertinib. Zipalertinib helps address the unmet need for patients who progress on chemotherapy and amivantamab, with amivantamab being the only EGFR exon 20 targeted treatment on the market right now. So it's nice to have data for an oral medication showing benefit in patients who progress on what is out there right now.
Absolutely, yeah.
And I also mentioned it was nice to see a follow-up to the Cocoon study. The Cocoon study, as a reminder, tried to address the dermatologic adverse events that occur in patients receiving amivantamab plus lazertinib from the Mariposa study. In the Cocoon study, those patients received prophylactic doxycycline or minocycline at 100 milligrams twice a day for up to 3 months, and then a clindamycin elution to the scalp for up to 12 months. And then they also received a hibiclens solution to the nails and fingernails and toenails, and a ceramide-based solution to the face and body. From the Cocoon study, they had already presented that this prophylactic dermatologic regimen helped reduce by twofold the risk of grade 2 or greater dermatologic adverse events. And what was presented at ASCO here were the patient-reported outcomes, showing that there was a threefold improvement in patients reporting not feeling any rash symptoms, and then also an improvement in reporting nail infections. So that's important for patients to hear that this newer regimen that's shown an overall survival benefit in EGFR-mediated lung cancer patients, that they are achieving good benefit outcomes as well as quality of life.
Yeah, absolutely. And quality of life has been spoken about again and again at ASCO 2025. It's not just about quantitative years, but quality of those months or years that you can achieve them. Thank you for sharing all that data, Danny. So besides that excellent data that we just heard about, what's been the highlight elsewhere for you in the conference? Maybe even coming away from the lung cancer space, because as has become clear this year at ASCO 2025, is from this original focus on solid tumors that ASCO once had, there's a lot more discussion of liquid cancers, the hemo cancers. So what did you want to perhaps highlight for viewers in that space?
Well, one of the major highlights that we saw, unfortunately, was that patritumab deruxtecan, when compared to chemotherapy, did show an improvement in progression-free survival but unfortunately did not show an improvement in overall survival when compared to a platinum doublet chemotherapy. So unfortunately, it was unfortunate to see that. There was early preliminary data to suggest it was going to be a good subsequent line option for patients that seemed to be tolerated well. Um, so unfortunately, with that data, I think they withdrew from the market, which also just goes to show that a platinum doublet chemotherapy for EGFR mutated non-small cell lung cancer patients is still a very good subsequent option for patients. Um, we also saw some frontline data for KRAS G12C mutated patients with adagrasib plus pembrolizumab, showing a good benefit for patients in that setting. We also saw a datopotamab based treatment regimen also showing a good benefit in the treatment naive setting. And then utilizing a sophisticated trope2 um, assay that utilizes AI technology, which was I found quite novel, and we'll see how that pans out in the clinical setting. We also saw other presentations testing newer, quote, fourth generation EGFR TKIs to try to address some of the treatment concerns of patients progressing on the current EGFR TKIs and trying to address patients who progress on the current therapies.
Thank you, Danny. And going back to your first share there, it's also important to show when the research does fail and it doesn't follow through now, because that's very much the lives of scientists in the field, if you will. So let's think really broadly now. I know I'm bringing you further and further from lung, but what do you think, given everything that's been discussed at ASCO, as much as you've heard while I'm on the ground, what do you think might very well hold very real potential for the transformation of the oncological space in the future?
Well, like the reference to that one datopotamab study, utilizing artificial intelligence in clinical decision making is going to be, I think, a very real tool that we might be able to utilize in the future across all types of cancers, whether it's lung cancer, breast cancer, colon, leukemia. So I'm going to be anticipating to see more of an AI-based approach in future congresses.
Thank you. And final question, any closing thoughts from the City of Hope, Orange County, if you can speak for it as a body, as to the Congress as it comes to a close soon?
Well, I mean, I think ASCO 2025 is further proof that we continue to make strides in trying to cure cancer. And I look to future congresses to see what keeps going out.
Absolutely. Thank you, Talia. It's been a pleasure.
Thank you.